Hello and welcome back to our channel. My name is Dr. Kosta Cvijovic. I am the founder and CEO of Vigilance, a full-service pharmacovigilance CRO. In our previous video, which we have linked for you here as well as in the description, we discussed the role of regulatory bodies in pharmacovigilance. Today we're going to talk about the most basic responsibilities of companies making or testing pharmaceuticals in pharmacovigilance, and these are the ICSRs, or Individual Case Safety Reports, which have to be processed by the companies, stored, evaluated, and reported to the regulatory bodies we already discussed. What constitutes an individual case safety report? As we discussed, there are adverse events and adverse drug reactions that happen when a medicine is used. These adverse events or adverse drug reactions that the company learns about either through clinical trials or any other kind of information pre or post-marketing of the drug have to be processed, stored with the company, and reported to the authorities, as already mentioned. However, not all adverse event information or adverse drug reaction information constitutes an individual case safety report or ICSR. There are four basic elements to an ICSR, and if any of those four elements is not present, then it does not constitute a valid report, cannot be properly processed or reported. These four elements are the name of the drug, the name of the event that happened, the reporter, where the information was received from, and finally, the patient identifier. Now, when it comes to the name of the drug or what event happened, these are fairly straightforward and self-explanatory. When it comes to the reporter, we need at least some information who reported the event so that we can obtain further information from them. And then finally, we have the patient identifier. This is probably the most complex of the four elements because it is a little bit difficult to determine what constitutes a patient identifier and what doesn't. It doesn't have to be too much information about the patient, and if it does include personal information that would make it possible to identify the patient individually, that information received by the company has to be treated very confidentially and cannot be reported outside of the company. So the patient's identifier's role is to be able to say that this is an actual individual patient in whom this event occurred. Examples of this identifier would be a gender, an age, a weight, or any kind of these individual informations. To give an example, one source of information for ICSRs post-marketing is the medical literature. When studies are reported in the medical literature, typically they only provide overall statistics of the patients that were included in the study and not individual patient identifiers. But sometimes it will happen that in a scientific paper, a table is published with individual patients and reactions that they had with the patient identifier, for example, gender. Now, in this case, every single patient, even if it is dozens of them, will constitute an individual case safety report, will have to be processed and reported to the authorities. Why is this important and why is this a challenge for many companies? The reason is that reporting to the authorities is often bound by very strict and very tight timelines. Only certain ICSRs have to be reported, not all of them, and we're going to discuss which ones have to be reported in a minute. But when it comes to some of the more serious ones, they have to be reported sometimes in a very short timeline. For example, in clinical trials, following most global guidelines and regulations, when it comes to fatal and life-threatening events, they have to be reported within 7 calendar days from the moment that the company learned about them. Or when it comes to other serious ones, they have to be reported within 15 calendar days we're going to discuss what constitutes a serious event in a minute. When it comes particularly to fatal and life-threatening events from clinical trials, some global authorities mandate even shorter reporting timelines than 7 calendar days. So as mentioned in a previous video, it is very, very important to be familiar with the current regulations in the country that you're dealing with and not rely on the general guidelines. Furthermore, besides being serious, an event has to fulfill several other aspects in a clinical trial specifically in order to be reportable within these short timelines, again, in most jurisdictions. It has to be a SUSAR, a serious, unexpected, suspected adverse drug reaction. Now that's quite a mouthful, but it actually makes sense when we divvy it up in its individual parts. It has to be serious. We're going to discuss what serious is in a minute. It has to be unexpected, meaning the company hasn't defined previously in the clinical trial protocol and in the investigator's brochure what events it expects to happen when using this medication in the clinical trials. It has to be a suspected adverse drug reaction, meaning the company and or the reporter, typically the investigator of the study, has to have said that they believe there might be a causal relationship between the product and the event that occurred. Now, what constitutes a serious event? We already mentioned fatal and life-threatening. These are very important aspects of seriousness for an event. Other criteria include hospitalization, either initial hospitalization or prolonged hospitalization as a result of an adverse event. Furthermore, teratogenicity, we discussed the thalidomide scandal in one of our past videos. Then we have either significant or prolonged impairment of any kind. And finally, we have the group of medically significant adverse events. Now, this can be anything that, in the professional opinion of a medical professional, would be serious. One of the classic examples is if a medication makes a patient dependent on it. We already discussed reporting of ICSRs from clinical trials. In clinical trials, the advantage is that there are systems set up so that any adverse events observed in a clinical trial is reported to the company and can be processed properly. In post-marketing, obtaining the ICSR is a little bit more difficult. Any information that any employee or affiliate of the company receives that constitutes an ICSR has to be processed and reported, and the timeline starts ticking as soon as any employee or affiliate of the company learns of it. This is why it's necessary to have regular trainings on basic pharmacovigilance for any employee or affiliate of a company. They have to know when they received an ICSR, and they have to know how to report it to their pharmacovigilance department for further processing. Sources can be an employee heard something from a neighbor about an event happening, they read in the paper about it. Sources can also be in the medical literature, which has to be monitored by any company regularly. Sources can be calls to medical information from healthcare professionals or patients to the company. Sources can be databases from regulatory bodies, which have to be reviewed regularly by companies, and many others, including, for example, social media. And here there are also additional requirements for monitoring, specifically for those social media sites that are maintained by the company. But any other social media site where any affiliate of the company learns of an event, the clock starts ticking, they have to report it to their pharmacovigilance department. When it comes to reporting timelines to authorities, typically in post-marketing, they're a little bit more lax than in clinical trials. Typically, here we have 15 days for any serious event. However, unlike clinical trials, not only SUSARs need to be reported expeditedly, but all serious events. And when it comes to post-marketing, causality is always implied. So an adverse event in post-marketing legally is always treated as an adverse drug reaction. It is possible for the company to state that it is very unlikely that the event is related to the medication, but they can never legally fully exclude the possibility of causality. One exception regarding seriousness is the European Union. Here, even non-serious ICSRs have to be reported to the authorities in an expedited manner, but only in 90 calendar days instead of 15 calendar days. So there is a little bit more time to do that. As you can imagine, some medications, particularly in challenging areas like oncology, generate thousands or tens of thousands of ICSRs every year. So it is a huge work to process all of them and report them in time to the authorities. And keep in mind, we're always talking about calendar days. So holidays, time off are irrelevant for the reporting timelines. Even though there are so many ICSRs and so much work for the companies regarding them, studies show that there is still a significant issue of underreporting, and some suggest that as few as 5% of actually occurring adverse events are reported either to the company or the regulatory bodies by healthcare professionals or patients. And adverse events are very, very important medically, as some studies show that they are currently in the United States the fourth leading cause of death. In one of our previous videos, we mentioned the CIOMS and the ICH. And the ICSR is an area where they became particularly prominent. The CIOMS with the development of the CIOMS form, which is used by most countries globally as the golden standard for reporting of ICSRs. It was created at a time when paper reporting was the norm, but the information captured in the CIOMS form is still contained in electronic databases to this day. So we have it shown for you here. And as you can see, the information, besides the four major elements that we reported, drug name, event name, reporter, and patient identifier, contain further information about the patient's medical history, seriousness of the drug, when did the event start, when did it end, when did medication start, when did it end, several other aspects of information that can and should be captured if it is possible, and then finally an area for the narrative. The narrative is an important part of the ICSR, and it should be a text containing all the relevant aspects of the adverse event report and being as detailed as possible. There are separate guidances from CIOMS and ICH on how a narrative should be written, and there is the ICH E2B R3 guidance from the ICH that specifically focuses on electronic reporting of ICSRs. We hope you enjoyed this video about ICSRs. If you did, please like and subscribe, and please comment what other topics you would like to hear more about. We have detailed trainings available on this and many other topics. You can find the link in the description or visit our website. Thank you so much and stay tuned for further videos.